Welcome to the Deep Dive. Today we're tackling something really practical for community pharmacists. How to see more patients efficiently for the hypertension case-finding service.
Exactly. It's a vital service, but time is always tight, isn't it?
Absolutely. So this is for all of you out there looking to really boost your impact, help find that undiagnosed hypertension, hit those CVD targets, but, without getting completely overwhelmed.
And we're basing this on the latest guidance, the updated stuff from Community Pharmacy England and NHS England.
Great. So practical, actionable tips based on the official guidance. Let's start at the beginning. Preparation, logistics, getting set up right.
Yeah, this is fundamental. Think of it like prepping properly before you start cooking a big meal. Get everything ready.
Makes sense. Avoids chaos later.
Precisely. And those Community Pharmacy England service checklists, they're gold. There are versions for new providers and existing ones.
Okay.
Using those just ensures you've ticked all the boxes. It prevents those annoying little delays when you realize something's missing.
Right. Avoids those, oh no, I forgot about X moments mid-flow. And the SOP, the standard operating procedure that seems critical too.
Oh, absolutely essential. Your SOP is your blueprint. It needs to cover everything, how often you check equipment calibration, for instance.
Using those validated monitors, the BIHS list one.
Yes, exactly, those validated ones. But also, who does what? Clear responsibilities. Support organizations offer templates, which is great starting point.
But you need to make it your own.
You do. Tailor it to your pharmacy, your team, your workflow, and crucially, review it regularly. Is it still working? Is there a bottleneck, say, with appointments? Adapt the SOP.
That links to staffing too, I guess.
Yeah.
Training the team.
Big time. If your team members are properly trained and competent, you can delegate tasks safely. That frees you, the pharmacist, up for the clinical supervision, the tricky cases, the actual assessment.
Right, playing to everyone's strengths.
Right.
Okay, let's talk kit, the hardware. BP monitors, ABPM devices. It's not just having them, is it? It's choosing the right ones for efficiency.
Spot on. When you're buying, think beyond the initial price tag. Does it include maintenance? What about training for the team?
Good point. And repairs.
Yeah, what's the turnaround time? Do they offer a spare if yours is being calibrated or fixed? Downtime is lost patient time?
And cuffs.
Definitely. Think about cuff replacement. How often? How much? And you absolutely need a range of cuff sizes. Small, medium, large. Essential.
And features. Some monitors have extras.
They do. Things like automatic multiple readings or flagging an irregular pulse. They aren't mandatory, but gosh, they can save time during the clinic check.
Okay. And for the ABPMs, the ambulatory ones.
Ease of use is key there, both for you explaining it and for the patient using it. And the software is user-friendly. Does it talk nicely to your IT system? That USB port for downloading data sounds trivial, but
if it's fiddly, it adds up.
it really does. Little things matter for smooth running.
And the guidance mentions insurance for the equipment. Seems sensible.
Very sensible. Covering against damage, theft, or even just a patient not returning an ABPM device. It avoids headaches and cost, keeps the service running smoothly.
Okay, operations are getting sorted. SOPs, equipment.
Mm-hmm.
But we need patients. How do we best promote the service and actually recruit people for these checks?
Yeah, you need a strategy. Don't just wait for people to ask. Community Pharmacy England has promotional materials, posters, digital stuff on their website, cpe.org.uk hypertension. Use them.
Get the word out visually.
Exactly. But also be proactive. Think about who you're talking to. Anyone over 40, really? Or younger people with known risk factors, gently start a conversation.
So integrating it into existing interactions.
Absolutely. Patients collecting scripts, especially if they aren't already on blood pressure meds, prime candidates.
Okay.
Mention it during an NMS consultation, a flu jab appointment, even pharmacy first, someone browsing the health section, maybe looking at monitors, that's an opening.
Seizing those small opportunities.
Yes. And there's a team briefing sheet and a patient recruitment guide on the CPE website too. Loads of practical ideas there.
Good resources. And what about doing checks outside the pharmacy? Is that feasible?
It can be. If you agree it with your local NHS contract managers, you could potentially run clinics off-site. Think community centers, workplaces maybe. Takes the service to the people.
Interesting. That could really boost numbers. Now, linking this all up, the GP relationship, that feels vital for smooth referrals and maybe even getting patients sent to the pharmacy.
Totally vital. You need proactive communication. Let your local GPs, the PCN colleagues, know you're offering the service, what it involves.
Don't assume they know.
Never assume.
Yeah.
Again, CPE has resources, a template letter or email for GPs, a service summary. Use them. Make it easy for them to understand what you do.
cpe.org.uk hypertension again for those.
That's the one. And see if you can establish local agreements. Maybe practices can refer patients directly to you for checks. That creates a really efficient pathway.
Okay, clear communication, making it easy for GPs. Makes sense. Right, let's move into the consultation room itself. The patient's there. How do we keep the clinic checks and the ABPM process snappy but accurate?
Okay, clinic checks first. Room setup matters. Simple things, like having the table at the right height so the patient can rest their arm comfortably. That aids accuracy and speed. And IT access nearby is essential for efficient recording.
Little ergonomic things.
They add up. Keep that visual guide for checks handy too, just as a quick prompt. And a key point for speed. Remember, it's high systolic OR, high diastolic, that counts as a high reading.
Ah, you don't need both to be high. That clarifies things, could definitely speed up the decision process.
Exactly. And obviously, if someone comes in symptomatic, make sure the responsible pharmacist knows before they leave. That's crucial.
Safety first, always. Okay, ABPM, loaning out kit, getting it back, explaining it, that can feel a bit cumbersome. Any efficiency tips there?
Streamlining is key. First off, always reset the device properly for each new patient. Seems obvious, but vital. Have your explanation ready. A clear, simple spiel about how it works, what they should do activity-wise normal day, but maybe avoid, vigorous exercise, how often it inflates.
Every 30 minutes during the day, usually. Aiming for about 14 readings.
That's the usual target, yes. And stress. Keep it dry. No showers with it on.
Got it. And appointments.
Pre-book the follow-up when you fit the device. Book them in for returning it and getting the results. Saves chasing later. Think about the timing, to fit it by 2 p.m. ideally to get enough readings before, say, 10 p.m.
Good planning.
And use the ABPM loan agreement template from the CPE website. Sets expectations clearly.
Pre-booking and clear agreements. Simple steps. Big impact on workflow. Okay, results time. How do we communicate those readings and handle referrals efficiently?
Flexibility helps. Offer different ways to give results. Print out, maybe email. Some patients might just want a photo of the summary on their phone, whatever works.
Okay.
And know your referral pathways inside out. Low, high, very high, irregular pulse Annex G in the service spec details exactly what to do for each. No hesitation needed.
Knowing the next step instantly.
Precisely. And the GP notification, it must be same day. Secure email or that electronic data interchange, no fax.
No facts, got it.
And use the suggested standardized titles for those emails or messages. Helps the GP practice triage it quickly, action required or for information only, that sort of thing.
Smart. Helps the receiving end process it faster. And templates again.
Yep, templates on the CPE site for capturing the necessary patient data for the GP communication. Don't reinvent the wheel, use the tools.
Absolutely. Okay, one last piece on the equipment maintenance. It's easy to let slide when you're busy, but presumably poor maintenance slows things down eventually.
It absolutely does. Regular checks on cuffs, hoses replace them when needed, clean the monitors and cuffs according to the manufacturer's instructions and your infection control policy. Use the right cleaning stuff.
And document it.
Yes. Your SOP should cover cleaning, maintenance, validation checks, recalibration schedules. Well-maintained kit works reliably, gives accurate readings, and prevents unexpected downtime. It's all part of the efficiency puzzle.
It really sounds like having those clear, defined processes running through everything from setup to maintenance is the key thread here for maximizing how many people you can help.
That's exactly it. Process, process, process.
Okay, let's just touch quickly on the money side, the financials.
Sure. So the main push with those extra incentive fees for hitting ABPM numbers, that finished back in March 2024. But the standard fees were updated from April 1st, 2025.
Right, what are they now?
It's £10 for each clinic check and $50.85 for providing the ABPM service. And remember, you get paid these fees even if the check was requested by a GP practice.
Good to know. Understanding that helps plan for sustainability.
Definitely.
Okay, so just to wrap up the main takeaways for pharmacists wanting to boost their hypertension case-finding numbers, it's about nailing that preparation checklists, solid SOPs, making smart equipment choices for the long haul.
Yeah, and proactively finding those patients, engaging them inside the pharmacy and maybe even outside.
Building those strong links with GPs and PCNs is crucial too. Streamlining the actual consultation and the ABPM process with really clear protocols.
And finally, don't forget regular equipment maintenance. Keep everything running smoothly.
Put all that together, and it sounds like pharmacies can really increase their capacity for this incredibly valuable service.
Without a doubt, it makes a huge difference to early detection and ultimately to preventing cardiovascular disease nationally.
And just a reminder, all those templates, checklists, guides we mentioned, they're on the Community Pharmacy England website. That's cpe.org.uk hypertension.
It's your go-to resource, packed with practical help.
Right. Which brings us to our final thought for you to ponder. Given how vital community pharmacies are for accessible healthcare, how else could you weave in quick, proactive health checks into your everyday workflow beyond just this service to catch issues early and benefit even more people?
Yeah, something to think about. Expanding that preventative role even further.
Exactly. Food for thought. Thanks for joining us for this deep dive.